So it's all interconnected. So the diaphragm is a very efficient muscle that draws the air in through breathing versus using chest muscles or intercostal muscles that are considered respiratory accessory muscles. Yes, that we can use in certain situations, and we do, but they're not as efficient.
I'm Mark Cruz. I'm an airway-focused dentist that advocates for wellness. My mission is to help you transition from disease management towards true wellness, starting with your airway. When your airway is limited in any way, it affects your sleep, your health, even your smile. We treat root cause, not just the symptoms, so that you wake up refreshed, live fully, and smile freely. Visit our website, markacruzdds.com. Breathe, sleep, and be well.
As we age, small changes in airway function can have big ripple effects on health, energy, and quality of life. Welcome, everyone. I'm Julie Schwenzer, co-host and producer with Dr. Mark A. Cruz. It's great to chat with you again, Doctor.
Thank you, Julie. Thanks for the opportunity. Appreciate it.
Yeah, we appreciate you. So this is part 2 of the topic from our last episode. Yes. And now we're going to look at how airway-focused dentistry supports aging patients from specifically a functional standpoint. Please take it away, Doctor.
Yeah. So, it's important to remember function, throughout life and how that changes. And also to understand the difference between competent function and compensated function. So competent function, as an example, would be like your normal gait when you walk that's balanced and integrated in all your body movements, very efficient. Compensated movement would be, let's say you have a sprained ankle, right? You limp to get the job done, to get from A to B as is needed, but you're compensated and protecting the injured ankle at the expense of some of the other muscles that are taking some of the load, if you will. And it's okay for a short term, but it becomes a problem when it becomes more of the norm, because then you start having an imbalance in the muscles, and the joints start wearing differently, and that's what results in problems, joint problems, hip problems, knee problems, ankle problems, etc. So that's just an example of the importance of having good, competent function versus compensated function. As it pertains to the airway, we have to remember that when we say airway, we're talking about the facial skeleton, and that is formed largely, initially, as we've talked in other podcasts, by the development of the airway very early on, from how you're born, if you're able to latch, how you chew, how you swallow, eventually leading to being able to speak and phonate. And so there's a neurology that develops throughout that process that really defines our function, right? So it's the neurology, it's the coming from the cerebellum, largely from the cerebellum, that gives us that muscle function. We have to remember in the airway, it has essentially a dual purpose. We call it an aerodigestive tube. That means that tube has two functions. It carries air to the lungs, but also food from the mouth into the stomach. And it's compartmentalized, if you will. So what affects one may affect the other in that aerodigestive function. So sometimes we see them as separate, but they're actually integrated. So we worry about choking. And so that's what the epiglottis is all about. Is it caps the airflow while we swallow, so that the food gets guided into the gut versus into our lungs where we aspirate, right? So that's an example. As we age, there's a tendency for that function to diminish, right? So, this is going back to why it's important to bend the curve as it pertains to aging by being active. We were designed to stress the muscles and the bones by physical activity. So the more sedentary you are, the poorer the function becomes, because it's something that has to be repeated and done on a daily basis. And the less that we do, the less intensity frequency and duration, the function is going to take a hit. It's going to become less competent, maybe not compensated, but initially less competent, which eventually may lead to compensation. So, for example, how we swallow. The elderly notoriously, eventually, oftentimes, has a higher risk for having deglutition problems, or fancy word for, say, swallowing, where we choke more or we aspirate more saliva into the lungs, introducing bacteria that don't belong there, that result in chronic pneumonias and upper airway infections and the like. And part of it is the function, the neurology, the muscles become weak. But the other part structurally is that the larynx starts to descend, um, and that makes this fleshy tube longer and more vulnerable. So those muscles have more collapsibility, if you will. And so that's very well documented in the um, sleep and language pathology literature, the feeding literature having to do with feeding. And so there are allied health professionals that focus on that, especially for the geriatric population, to make sure that we can maintain those important functions, because they are important. They lead to problems for the elderly. There are studies to show that if you are an opera singer, or you sing a lot, or you're in the choir, or you play a wind instrument, that's super helpful in exercising those muscles. And so if you're able to do that, you less likely snore, or snore less than you would otherwise, for example. Because snoring is as a result of the airway collapsing, and the turbulent airflow from the collapsing flow limitation creates that sound that we interpret as a snore. So these are things that we say it's, part of getting older, but actually reality is, yes, time has a factor, but a lot of it has to do with really our function. So, hopefully that can give a little bit of overall on how, for the elderly, good airway health, good myofunction will really help. Now, if you've got good hardware, good structure, wide palate, um, big airway, then you're more immune to these problems. If you've gone through treatment, and as a teenager, maybe you had teeth extracted and you were retracted, and you have the mid face of an 8-year-old, when you're in your 70s, um, because of that stunted facial development, either because it was partly from growth and development, or it was made worse by intervention of some sort. Those are just risk factors for any individual.
And how do we apply, like, if you don't, move it, you lose it? In this case, like you mentioned, singers or people who play instruments,
Yes.
they're doing more to help prevent some issues. Or if you have good structure, what about the rest of us? What do we do? What can we do to prevent having some functional issues down the road?
Yeah. Yeah. A lot of it, it's going back to what we talked about in other podcasts, from the very beginning, from when we're born. We want 5 competences. So competence is something we do very easily without thinking about it, and it's done very well. And that is that we breathe through our nose 90% of the time, except for when I'm speaking, right? We're going to have a little bit of air coming in to phonate. But for the most part, 90% of the time, well documented, we should be exchanging gas through our nose. Uh, Lips together, tongue on the roof of the mouth, it seals off the oral cavity. So we are breathing and through the nose. It's supporting nasal breathing. Non-collapsing pharynx during sleep. That means we don't snore, and air flows very smoothly, very nicely. And diaphragmatic breathing. So it's all interconnected. So the diaphragm is a very efficient muscle that draws the air in through breathing, versus using chest muscles or intercostal muscles that are considered respiratory accessory muscles. Yes, that we can use in certain situations, and we do, but they're not as efficient. The regular plan is those 5 competences. So as we age, we want to make sure that we maintain that. It's just kind of like, going to the gym, eating right, things that you could do are exercise. You go on the internet, you can Google it or go on AI, ChatGPT or Claude or Gemini and look up what are some good exercises for airway, muscle function, or oral posture. And you could try to do those. I think it's best guided by a professional, an allied health professional that really understands. But those are things that can be done, but it's not really largely public knowledge at this point. People don't really think too much about it until they're in trouble. And that's when they go to an allied health professional to have therapy. So you go to see a physical therapist after you had knee surgery, right, to rehab. But there are some preventive steps that could be taken, and you could educate yourself in that regard.
Well, Dr. Cruz, thank you so much for breaking this down and bringing attention to, I think, an area of health that a lot of people usually don't. I mean, I don't hear about it in my circles, and it's really great that you're enlightening us with this because if it can help somebody prevent a major issue with their health, I mean, that's great.
Yeah, absolutely. I hope it was helpful. Thank you.
Thank you. And again, you broke down that so nicely, the functional side of aging and airway health, and we always appreciate your time.
And likewise, thank you.